For guests and visitors, my name is Jim Farmer. I'm club president-elect, and I'd like to welcome you to the 25th meeting of the 49th year of the Dublin Worthington Rotary Club. Next year, both the club and I will officially be old. Okay, for today's invocation and pledge, we have the one and only Tom Rice.
For what? Wait a minute.
Wait, there are two of us. Yeah. Hi, Tom. Hey there. Let us pray. Gracious God, we thank you. In this week of bitterly cold temperatures, we thank you for the warmth of friendship. In this time of doctors warning about a pandemic of loneliness, we thank you for the gift of Rotary, friends with whom we find meaning and purpose and opportunities to make a difference. Bless this time together, we pray. Bless our meal and our conversation and our program, that we might be strengthened, body, mind, and soul. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Okay, we're going to reverse order a little bit today, and our speaker has some other conflicts. So without further ado, I'd like to welcome
Yeah, well, I would too.
I'd like to welcome Tim to introduce our speaker.
Hi, everybody. Good to see everybody. Hey, Jim. Can I welcome our assistant governor?
Oh, yes, you may. Well, that'll happen later too. Go ahead.
All right, well, but Dave, because we really appreciate your being here. I'm gonna let Jim do it again, but without further ado, I think we give a one clap welcome, don't we, for our assistant AG, Dave Dewey?
Yeah.
It's my delight, you guys, to take the august mantle, with Joe Patchen of, bringing speakers, to you for our programs. And so, without further ado, I want to say a couple things about Dr. Nathan Overmeyer, who is our county coroner and here to speak to us today. I think about his the new forensic center that we've all helped pay for. But before I do that, I want to take a quick opportunity to introduce his two staff members that are here with him. I think many of you have met my dear friend, Pat McLean. Pat, wave your hand for everybody. Pat's been here before in previous incarnations, but Pat is Nathan's chief of staff. And also Jeremy Blake is Dr. Overmeyer's senior strategy advisor. Thanks, Jeremy. So a couple quick words about Dr. Overmeyer. Nathan Overmeyer was appointed in December 2022 to our office of Franklin County Coroner. He was commissioned to assume the role on January 3rd of 2023. Dr. Overmeyer is an osteopathic family physician. In fact, I think he's a protege of my good buddy, Bill Burke. Bill Burke, as you guys may recall, some of you may recall, went from a pretty eminent family practice to be in the dean, I think it is, Nathan, of the OU Osteopathic School in Dublin. So we're still trying to get Bill to come here to talk to us, but we know he's a busy guy. I think Dr. Overmeyer attended school more in Athens than the campus in Dublin, but he's been a full scope primary care physician for the last several years. He was affiliated with acute care roles at Ohio Health, and he's also a part-time faculty member at the OU Osteopathic School in Dublin. At the State House, he's testified on vaccine bills, assisted in advocacy efforts on state policy, and he currently serves as the Central Ohio Region Director of the OAFP Board of Directors and served on behalf of the OAFP, which I assume means family physicians, as the new physician delegate to the American Academy of Family Physicians at their national conference. Dr. Overmeyer is co-chair of their public policy group in Ohio. And I know he's really excited about his emerging roles as the coroner. Would you please join me in giving him a warm welcome? Steve, have you got control?
Thank you so much. Thank you. Thanks, Tim, for that warm introduction. Thank you all for welcoming me into your space. I'm really excited for this opportunity to speak with you today and get to know some of you a little bit better. And again, I apologize for having to leave a little sooner than I had anticipated. The Ohio State Coroners Association added on a board meeting this afternoon, so as I'm on that board, I probably should show up there. So thank you for being flexible with your time today. I'm really excited to be here with you all today. I'll keep my presentation short and sweet, so I'll leave some time hopefully for some questions and answers, if that's all right. So, this is me. I'm Dr. Nate Overmeyer. I'm your Franklin County Coroner. A few quick things about me. I'm from Fostoria, Ohio, Northwest Ohio, if you're not familiar. I came down to Capital University for undergrad. I did my medical school training at OUH-COM in Athens, and then I came back up to Grant Medical Center for my family physician residency training. I studied in Spain while I was at Capital. Not quite bilingual anymore. I've lost a lot of it. You know what they say, if you don't use it, you lose it. But I love my time in Spain. It was one of the most important aspects of my life because it's the time I realized that I wanted to be a physician and how I wanted to help people. I missed all of that biology training and all of the work that I was doing at Capital, and that's when I knew I wanted to be a physician. But I love to travel. I'm a huge Crew fan and Columbus Blue Jackets fan, but the biggest one, the top of them all, I'm a huge 49ers fan. And you might ask yourself, how the heck is this guy a 49ers fan? So my grandma used to live in San Francisco. When I visited her when I was 4, that was back in 1990. I know, that's, in 89, we were really good. And that's when we won our last Super Bowl. So you can imagine Jerry Rice, Steve Young, that's when we were really good. And so I just fell in love with the team. And yes, I will actually be there in Santa Clara this weekend for our first playoff game. And Jeremy was really excited because I told him he was so anxious about them being in the playoffs because this past weekend we had a lot of things on the agenda, most importantly including MLK Junior Day this past Monday. And if I was going to be in San Francisco for our first playoff game in the wild card, he was like, Dr. Overmeyer, this is good. This is a really big, you're gonna have to make a really big choice of going to your fun stuff while doing the really important work here in Columbus. So I'm glad we had our first week by, and I'll be in Santa Clara this past weekend. All right, enough about me. So recently we moved. So if you have had, unfortunately or fortunately had any interactions with the coroner's office, you know our building used to be located on Ohio State's campus, but in 2020, in the midst of the pandemic, we moved to our new facility on Frank Road, which is just a little north of Grove City, and we're happy to be there. So like Tim said, yes, we are taxpayer funded, so all of the county money funnels into a general fund, and we use that money for our salary benefits and our facilities. So when is it the coroner's jurisdiction? So what's my role? So when a person dies by violent, suspicious, unusual, or sudden death, it becomes the coroner's jurisdiction. So in Ohio, the coroner is the only physician who may certify deaths that are not due to natural diseases. So if you're 80, 90, 100 years old and you have known coronary artery disease and you, how I hope to pass is that, the good Lord takes me in my sleep one night, that's not the coroner's role. That's a natural disease state. Your primary care physician will sign that death certificate. If you fall, or if you use drugs and overdose, if you get hit by a bus, if someone murders you, those are all coroner's cases. And our mission at the coroner's office is to preserve and protect the interests of the community by maintaining the highest standard of professionalism and integrity in determining that cause and manner of death. That is our role, determining cause and manner of death for those who have died in Franklin County. So who works with me in the coroner's office? So we have a dedicated staff. We have 7 pathologists and 1 pathology assistant. We need 2 more, a little bit because of the growth of our county, which is good, right? But as our population increases, so does the amount of people that die in our county. So that's to be expected, but gosh, ever since 2015, we've seen a huge spike in the amount of overdoses that are, that's contributing to deaths in our community. And gosh, like we just talked about, if it's an overdose, it's an accident, and those are coroner's cases, and therefore we need more pathologists to do those autopsies or exams to determine cause and manner of death. So we need 2 more, and those are not cheap doctors to hire. And so we need more of those folks. We have 13 investigators. Those are the folks that go out to the scene to collect evidence, take pictures. We have morgue technicians that assist in the autopsy room with the physicians. We have morgue attendants that receive bodies and release bodies. We have toxicologists. We have a huge toxicology department. We have 9 toxicologists. Those are those, when I was in, I'm a biology major, and so I always saw those chemists as kind of weirdos. We're in the same building, we're on the same floor, but I just like, oh, those people are a little weird. Now I have to work with a lot of those chemists who are doing the important work of, figuring out what sort of substances folks are dying from. We have front office staff and administrators that work in the office. Something not new to the office, but something I'm really focused on is dedication to our community. So a lot of what we're doing with Jeremy's and Patrick's help, we're getting out in the community, doing a lot of outreach and collaboration with folks. We're also bringing the community to our Forensic Science Center. We have this beautiful $30 million facility that the residents of Franklin County helped build. And so we're trying to get more folks who are interested in forensic science out to that facility, so that because there is a workforce issue and we need more dedicated folks to help in all the processes that we work in at the coroner's office. But we're also dedicated to really important issues. So when we talk about the things, how people pass away within our jurisdiction, it's all about gun violence and our opioid epidemic, the overdoses that are harboring us. We're dedicated to highlighting really important issues like Black suicides in our community. The rate of Black suicides has increased substantially in the last several years to months, and we need to highlight that, bring awareness to that issue, and then take that data, take that information to our stakeholders and public partners so that they can continue to study, ask the why, and then really it's a call to action. We don't want folks to die from preventable diseases, and when we have certain vulnerable groups like and we see a spike in Black suicides like we have over this last year in 2023, it's a call to action to our stakeholders. And then you're gonna think of me as someone who's all about emergency preparedness. Unfortunately, it's not a matter of if, but it's honestly a matter of when there's gonna be a mass incident, a mass casualty or a mass fatality incident. So Jeremy, Patrick, and myself, we have to be prepared for not if that happens, but when it happens, so that you're gonna be seeing me, you're gonna be seeing Chief Bryant, you're gonna be seeing the mayor, be prepared and act vigilantly and on behalf of the public's best interests. And so I'll kind of run through this a little bit. I gave this presentation to DEA Summit, so I'm just highlighting some particular data sets. And we have lots of data, that's kind of what we do at the coroner's office. We know why people are dying, and so we need to disseminate that information. We need to share that so that stakeholders and policymakers and partners can take that information and do something with it, because this is, I think, not bad data, like it's data, it's good data, but we don't want to see people dying from preventable diseases. So we want to share that information so that we can reduce that number. So for example, I'm just highlighting some data we have regarding accidental overdoses, and we can sort of geolocate the number of folks who have died in Franklin County by race and ethnicity. And now this is, we just finished our 2023 data. So when I first made this presentation a few months ago, we only had Q1 and Q2 of the calendar year, so January through July. We've just finished the entire 2023, so in the next several weeks, I'll be crafting a new PowerPoint and getting all the newest data for you, but the data really hasn't changed over the last several months. So you can see here highlighting like the Hilltop and Linden. Those are places that you sort of expect and where you can see highlighted where the most overdoses are happening. And then in a table way, we're breaking down acute intoxication by race and ethnicity. We can compare 2022 data to 2023, and you can see that it's unfortunately stable, if not going up in certain categories. And this is the most important slide to me actually. So that when we're breaking down age-adjusted rates, so the rate to me is really important because yes, there are more white people in Franklin County. If you Caucasians make up about 70% of the population in Franklin County, with, 20%, 20% of the population are Black or African Americans. But when you look at the rate, the amount of people who are dying per 100,000 people, just looking at per se, Q2 in 2023, you can see white folks died at a rate of 14.2, but gosh, African Americans died at 24.5, nearly a double fold increase. And so, yes, there are more white folks who are dying of overdoses in terms of volume, but gosh, when you look at that rate, if you are a 35 to 55-year-old Black man, you have the highest rate of dying, and therefore the highest risk of dying of an overdose. I have a question, go ahead.
Those percentages or numbers per thousand?
Per 100,000.
It's per 100,000. And then we can make data on all sort of demographics. So when we talk about gender, so I'm highlighting more men die of overdoses than females. And we can break it down through race, ethnicity, and gender. And you can see certainly more men are dying, like we said. And again, more white males are dying, but the rate, when you look at Q2 2023, there's 77 white men who died versus 52 Black men. But then when you look at go back and look at the rate is much higher because there are less Black folks in our community and they're dying at a higher rate. We can look at age, and this is actually surprising me. When I first started, I thought, oh, all these 20-year-olds these are the druggies, right? That's what they say. These are the folks that are using drugs and they're the ones that are dying. Not so much, right, folks? So as you can see, in Q2 of 2023, look all the way down. My heavens, 55 to 64. 55 folks in that age range passed away from overdoses. That was surprising to me. I thought, this can't be right. The more you dig into it, the more you see, yes, if you're 35 to 55, you have the highest risk of dying of an overdose, not the young folks that I think the media often portrays as folks who have the drug issues, or those that we often think of just kind of in a biased sort of way of doing drugs. And we can break down by substances. So we know that fentanyl is killing most of the residents of Franklin County, with 172 folks in Q2 of 2023, followed by cocaine and amphetamines. And you can see, unfortunately, the rise of cocaine and amphetamines. It's slight, but it's still a rise. Thankfully, there's been some waxing, waning of fentanyl, but unfortunately, it's still staying high, and we're not seeing a drop in those substances. And surprisingly, alcohol, right? And we have such a sort of a liberal way about how we think about alcohol, but man, I actually saw a lot of acute intoxication by alcohol, intoxication and chronic ethanol use that's killing a lot of our folks in Franklin County. These are some smaller ones and kind of just breaking it down a little bit further, and then we can break it down to a different form as well. So with that, hope that was a good primer of what we do in the coroner's office, and I want to make sure I save time because how often do you get a chance to talk to the coroner, and I want to make sure you answer some questions. Go ahead.
I've got 5-year-old level questions here. Why did you want to become a coroner?
So, well, I always wanted to be in public service. And so I think about servant leadership. I've always wanted to be, I'm a son of a single mom, and she wasn't around a lot when I was growing up, so I had to kind of take care of myself. And then when my sister was born, I had to take care of her. So it kind of came natural. And then this love of just caring for people, whether it's, Jeremy and I were just talking about our horoscopes the other day. I'm a Cancer, so we have this sort of empathetic, sort of like natural sort of tendency to care for people. But I've always wanted to do that, and that's why I became a physician. Now, the thing was, right in the middle of residency, I learned about social determinants of health. And at one point I asked myself, gosh darn it, why am I taking care of all these people with end-stage COPD, end-stage kidney disease, end-stage cardiovascular disease, and I'm just helping their symptoms until they pass away? I want to focus on the upstream effects. I want to think about and tackle some of these issues so that we don't get to those end-stage diseases. And that's when the light clicked of, okay, when we talk about servant leadership, I want to get to the root cause and address issues before they become a big problem. And the best way to do that is become a policymaker. So back in 2020, 2021, 2022, I was talking to some colleagues and figuring out how I can be a better advocate for my patients. And that meant going to the State House, being an advocate. And you can see down the road how that led to being more in public service. And I got literally a call, this was a calling, to say, hey, your predecessor had just retired, Nate. would you be interested, because we know that you're leaning on running for a public office, would you be interested in considering the coroner? And because you do get to tackle some big hot button issues like gun violence and suicides, suicide prevention and the opioid crisis, you're passionate about that. And so here we are.
Awesome.
Thank you. I think I saw you, and then you.
The question, obviously, a lot of drug users and maybe not so much drug users, died from fentanyl. I think I saw 172. So how do you determine, I guess one of the questions is, right now, a lot of drugs are laced with fentanyl, and
Yes.
when you find that information out, how do you determine from a police enforcement, is that some, where drug use can be, I guess, a murder for giving bad drugs, or how does that come together?
My friend, you've hit on maybe the biggest hot topic issue right now in our community, right? So, and this is a hot topic issue in the pathology world as well, because classically, if you and me are doing drugs together, the definition of a homicide is direct and purposeful harm to another that causes their death. An accident is not direct and purposeful harm. And so if you and I are doing drugs, that direct and purposeful harm by someone else is disrupted because I am also, and if I pass away, that becomes, in the classical pathology world, that's more of an accident because I am using the drug. The responsibility is on me. That it changes when, certainly, what's very clear is if I'm poisoned. So if I'm not knowing I'm taking a particular substance and someone is intentionally putting fentanyl, or the classic cases, the wife is killing the husband because she's putting the cyanide in his coffee every morning, like that's a classic poisoning, that's a homicide. But if we're both doing drugs and I know I'm taking drugs and you know you're taking drugs, but maybe that's laced with something, and now I don't know that I'm taking fentanyl laced, a pill that's laced with fentanyl. Gosh, now we're getting some murky water, and we're certainly working with law enforcement to figure out the best steps forward. But gosh, this is not a set in stone or determined understanding of what's going on right now. Right now, we're still using a lot of accidental, we're using the manner of death as accident, but we're doing a full autopsy oftentimes, because when law enforcement does want to charge a drug dealer or someone else who is distributing those drugs, then they want to be able to charge them on a higher level and have that defense of, hey, this person didn't die from a natural cause.
Can you determine if, like I took marijuana, if it was laced with fentanyl, can you determine that marijuana was the drug?
Yes, so we analyze the blood, urine, the vitreous humor, and we take those levels and know the lethality, or if there's a specific range of fentanyl that's lethal or not fentanyl, or not lethal, and so we can determine that based on a quantitative analysis. And so we sometimes we'll collect the evidence, whether it's a pipe or whatever tool that you may be using to do your drug, and we'll collect that sample, and then we'll test the blood and figure it out through that way. Go ahead.
Well, I have a two-part question. One is, what procedures does your office go through when I'm hit by an automobile?
So when you're hit by an automobile, the first thing you do, and so if you passed away from that accident.
Yeah, I died.
You died. So the
Very nonchalant here. No, it's inevitable, folks.
Was behind the wheel.
So what will happen is that law enforcement will arrive to the scene. If you were still living and they tried to revive you, but that didn't work, certainly EMS may arrive to the scene to try to revive you. But if it's clear that you passed away, so law enforcement will arrive. Okay, someone will need to pronounce you on the scene, whether it's EMS or someone like that. And then if it's clear that there's no revival, then they'll keep you on the scene, and then our investigators will come to collect evidence, take pictures, and ultimately you'll be transported to our facility for the autopsy. And then once the autopsy is completed, then you're released to the funeral home.
That you will do an autopsy.
Every case has its own merits, and it's ultimately the discretion of the pathologist to determine the best way to proceed. Sometimes in a gunshot wound to the head, we know that the gunshot wound killed someone, so we don't need to do sometimes a full autopsy. If it's a homicide, yes, because unless that defendant is dead or there's no chance that will go to court, the prosecutors will require us to do, like, not require us, but it would be pretty bad taste if we did not do an autopsy on a homicide victim. But certainly for like a suicide where there's a clear gunshot wound to the head, we may only do only open the cranium and do tissue samples of the brain, maybe not do a full autopsy, but it's at the discretion of the pathologist.
Okay, the second part of this question is, how does your office classify it if I get so drunk that I walked out in front of that car and they killed me? Is that a death by alcohol or is that a death by stupidity?
No, what was the direct act what was the direct thing that killed you? That was the motor vehicle collision, right?
That was MERS.
If you had not gotten hit, then the alcohol probably wouldn't have killed you, or it would have killed you in a different way. I had a question, young lady?
You mentioned preparation for mass casualty events. How do you coordinate with state and federal government entities in that case?
We try to do it very well.
Better repeat that.
Oh, the question was, how do you coordinate with state and federal agencies when considering mass casualty or mass fatality events? So Jeremy, Patrick, and I went to a training with EMA, our local EMA emergency preparedness agency. And so we have a Franklin County preparedness unit, and there are other state and federal agencies that we do trainings with. We went out recently back in September, we did a simulation where there was an airliner that was part of a terrorist attack, and the plane landed and had many fatalities there. And then there was some subsequent events that happened because of the terrorist event, and we had to think about how that would work. So we do simulations, we do classroom trainings, working with both local, state, and federal officials. And we're trying to be as coordinated and as prepared as possible. Go ahead, I got 1, 2, and then 3. And I'll, maybe 5 more minutes, and then I have to go. And go ahead, sir.
So I've got some questions. The 55 to 65 on your chart. So you are interested in root causes. So tell us about why you think that's going on, because you said you were surprised too about the overdoses and that. My second question is, how can you tell if your wife is putting cyanide in your coffee before it's too late?
We have some cyanide test strips. No.
This is only one, they're available to CVS.
Worried about it.
So we are actually in the process of hiring an overdose investigator. And what that person's main responsibility will be to go out and collect more psychosocial history and analysis. But anecdotally, from what I've learned over the last year is that most overdoses happen in people with habitual use of drugs. It's not folks that are just at a one-time party and I'm gonna do a bunch of cocaine. While that does happen, and certainly we have terrible examples of that happening, it is folks who have, unfortunately, the disease of addiction. And one of my goals over the next year is to talk about addiction and mental health and make sure we're getting folks into treatment and recovery. But I think that's part of it. I think that disease of addiction, it does take time, and it's not someone usually in their, while it's true that there are folks in their teens that are getting hooked on drugs, but that drug use does take years to develop, and it's usually at some point the disease is getting overburdened, and they're sometimes will take a pill that they don't realize is laced with fentanyl. That does happen, but oftentimes it's to the point where they're building up so much tolerance. But one point is that they're just overdose and they're not taking it with someone else, and no one's there to help them, and that we see that a lot in that age population. And one more question. Does that answer your question?
What do you do about organ donations with bodies that come in, determine what to harvest, if they are an organ donor?
That's a great question. And we're trying to really reset our relationships with Lifeline of Ohio. That's the organ and tissue procurement organization in Central Ohio. Right now, the main procedure is, keep in mind, to be an organ donor when you pass away, you have to be still living in a way. And so what that means is that you still have to be on life support to be able to give your organs. So if you passed away at a scene, like, you know, if you got hit and you're not in the hospital, no one's pumping your blood through your organs, that's not gonna be an organ donation, that's gonna be likely a tissue donation. And so our cases, will be at the hospital, so that decedent, the person who died, they'll be at the hospital, and when if they're considered to be brain dead at that point, then the lifeline, the organ procurement people will have a discussion with family, with the hospital system to say, hey, should we proceed with possible organ donation? And likewise, if it's more on the tissue side, so if there's no chance of harvesting organs, then there's an opportunity for tissue donations, and that person does not have to be hooked up to a machine to continue blood flow. But we're trying to make sure if you are an organ or tissue donor, we want to make sure we honor that request and provide organs and tissues to folks who need it. Patrick and I were privileged enough to go to Dayton, where there's a really huge tissue factory, I guess you could say, where they're processing all these tissues and making new ligaments, making new discs for our spinal cord, and it's amazing all the amazing things that they're doing. So we're certainly working to making sure we're empowering those relationships so that we're honoring folks if you do have if you're a donor. Lightning, and certainly if you have other questions, I'll always be available. I love Rotary, and I'm so thankful for all the work that you all do, so thank you so much.
Appreciate it. Okay, we will now start our meeting.
If I could just interject, for those of you that are interested in the data, we do have that on our website. And so if you just go to the corner.franklincounty.ohio.gov, there's other data available there. That's if you're really wanting to dig a little bit further. So sorry to interrupt.
That's okay, fine, thank you. All right, our once and future king, Steve Parley, will now introduce visiting Rotarians and guests.
I don't know what you're talking about with this future stuff. If Pastor Tom Rice is to be the Tom Rice, then I guess that makes our guest Tom Rice, other Tom Rice, so please help me welcome our honorary member, Tom. And then I believe, Tim, you had a guest.
Yeah, I'd like to introduce my friend Linda McGann.
Oh. I think everybody else here is accounted for, so we're good.
Okay, anybody with announcements, please make your way forward at this time. I'll get it started with a couple that I've got. We're gonna have a Ways and Means Committee meeting next week immediately after our Rotary meeting. Jim Miller will be presiding over that. We're gonna talk about what we've done in the past year to raise money, what we need to do in the next year to raise money. If you have any ideas on any of this or any other items you want to put on the agenda, just send an email to Jim if you would. Also on Super Bowling, I'm going to announce that we are at about $1,500 in terms of lane sponsors, which is great, but we want to get to around 3,000. So all of you who have been thinking about doing that, please contact me. I know you want to do it. We only have 17 days left to the event, and we have 3 teams signed up. So, which is about par for the course for us, actually. I'm not panicking just yet, but please think about putting teams together and attending the event on February the 3rd. Okay, anybody else with announcements?
I have some sad announcement. Cindy Wentz, the widow of Bill Wentz, had a stroke on Sunday. She is at Riverside Hospital recouping from it. Information at this time is still pretty sketchy, but apparently it affected her left side and she'll be in therapy for a while.
You never know.
Not quite as tall as the previous speaker. I just wanted to thank everyone who has volunteered to help us out on Saturday with the Rotary Youth Exchange weekend. And I wanted to let volunteers know that I'll be sending out emails with timelines and details either tonight or tomorrow. But if you have any questions, please reach out to me. You can email me or text me, call me, whatever works best for you. Thank you.
Hey again, our Impact Club is meeting tomorrow at the Porch Growler in Worthington at 5:30 PM. If you wanna come by and just hang out, or if you know somebody that would wanna come by and hang out, thank you.
Well, and it's me again. I just want to alert everybody that next week we're gonna have an online meeting with our twin club in Mongolia. Argu is gonna be on the screen, so don't miss it. You'll learn some more Mongolian, I'm sure.
Hi, folks, from the district, just wanted to announce, I think Terry Radachek is gonna leave the foundation and be the district nominee from the Marietta group, so they'll be looking for someone in that role. And he just sent out an update on the foundation, so continue to focus on that, and I'm sure Teresa will get that to you. But I wanted to introduce you to the new Houdini for next year. And when I say Houdini, the theme is the magic of Rotary. So there you go.
Yeah, pull that out of here.
Okay, our sergeant today is Alan Grossman, and please act surprised because he was.
Maybe. And so I had a committee meeting with all the people I was sitting with before my table mates got here today. And the committee decided that it was the chairman of the sergeant committee's fault that I didn't know that I was sergeant today. So he's graciously agreed to carry the pot. While he's coming up here to get it, I would like to know how many emails do you need? I need to know. And while he's coming, if 3 is not enough, it's not on me. While he is coming up here, I think I didn't get an opportunity to welcome my most beautiful wife, Heather, of course, is here on Zoom watching. And so she's happy. Heather, I'll wait for her. And then before we get into happy dollars, Steve asked me to find the phone that went off $3. It's his thing, man. And just saying, I mean, that doesn't preclude you from the $3 limit because it's a special fine. But anyhow, who's got happy dollars today? Is anybody in this room happy? Besides Jim Farmer, who has 3 people signed up for the. Peggy.
Yeah, I'll be gone, the whole month of February, we're going to North Carolina.
What does that mean? Everybody should put, no, never mind. All right.
So you're happy you're not gonna be able to be with us?
Something like that. Who else is happy? Roger.
Well, this past weekend, 24 of our family went up to northern Michigan, 20 inches of snow, snowmobiling. Including my son, wife, and 4 kids from Naples, Florida, and they love it.
Oh, well, I can imagine that.
How many came back?
And I guess they would answer the question why you would go to northern Michigan this time of year. Who else is happy?
It was actually colder here than it was in Michigan.
It was cold here, for sure. Anybody else happy? Come on, guys. Somebody's gotta be happy. Jerry?
Well, the treasurer's happy that there's so many people in attendance today and so many on Zoom.
Yep.
So we really should give ourselves a hand.
Yeah, I agree. Nobody else is happy?
I'm
Yes,
happy that you can buy cyanide strips.
Wait a minute, let's check with our resident toxicologist. If that's, yeah, no,
I'm happy just because.
yeah, there you go, Charlie. Thank you. All right, so I guess we'll, yes, sir?
I don't know if it's happiness or humor, but why is Butterfield so concerned about all this?
Yes.
We all should be happy that Charlie's in long pants.
Yeah. Okay, then, let's call for happy dollars. In that case, we'll start with whomever was not happy today, throw in a buck. That'll teach you all not to come to our meetings happy. Right? And for that matter, whose birthday is this month? Yes, I knew that. And whose birthday was last month? No birthdays in December, how about February? Jeff's birthday's in February, so everybody else will give him a birthday present to our pot. Perfect. Jeff, you're off the hook on that one. Anybody else besides Peggy traveling? Here coming up?
Yeah,
Okay, where are you going?
I'm going to Cuba. I'm going where it's warm. 2
Oh.
weeks from today.
That's worth $1 for sure.
Bring us back some rope.
Anybody traveling
You're
to
right.
London, please, add $1, yes, sir.
Key West.
Key West. That's far south,
There's no snow there.
not as far south as Cuba, no.
Disney cruise.
Disney cruise. It's another $1. That, and who did not, I think we had, I think we had a rah-rah in December. Oh, we had a party, it wasn't a party, rah-rah, it was a party, who didn't go to the holiday party? Okay, you can add $1 if you haven't reached your $3. Cause we had a lot of fun and Christy did a lot of work. And who here has, we've got $1,500 in lane sponsorships, who's done that? Anybody here? Okay, if you haven't done that, add $1 and we'll at least be on our way, a little bit closer to that. And with that, I'll leave you all alone with, wait a minute, I'm not done yet. That's $1 for you, sir. What do you call a cow with 2 legs? Lean beef. And if he has no legs? And if he has no legs?
Round beef.
Ground beef indeed, thank you all.
Okay, to wrap this up, we have a raffle. Bonnie is going to circulate and draw a number. Check over here. Yeah, you don't need But people with money following you can.
The last 4 digits are 3064.
What was it?
3064.
Oh, so
Oh, it's right behind you.
watch out for the silence.
You guys can't tell my wife about it.
Be careful.
He's testing.
3093.
I don't think that's amazing. That's probably wrong.
3093.
Going once? Going twice?
Yeah, I hear. Wake up.
Oh, you finally woke up.
Whoa.
Whatever you do, don't pull it.
Why the foundation?
Right up there.
Here we go. Don't tell Pat.
Only if you win.
All right, on that sad note, we have a 4-way test. We'll drive. On behalf of all the things that we think, say, and do, first. Second. Third. Fourth. Thank you, we are adjourned.
Okay. Very organized. I can't wait. Okay. They got one flight every day.